Disabled people are more likely to be unhealthy, but is this inherent or imposed? Hello people, I hope you're all keeping well, keeping safe and keeping your distance. My name is Ben Andrews, I'm an expert in inclusion for disabled people and this channel is dedicated to just that. If you're into this type of content, make sure you hit that subscribe button and ring that bell. In this video we're going to be exploring whether the health inequalities disabled people experience are inherent to being disabled or imposed by society. So with that being said, let's get into it. Disabled people face vast health inequalities, being more likely to develop conditions such as obesity, diabetes and depression, impacting quality and longevity of life. There's a perception that these inequalities are somehow inherent to disabled people, with ill health and even premature death an expected consequence of being disabled, and with this good health unattainable. This makes the inequalities experienced by disabled people more easily dismissible, as the cause is already perceived as defined, resulting in less attention and exposure given to more extrinsic influences. This would explain the lack of coverage and reaction given to the fact that 2/3 of all COVID-related deaths are disabled people. Less exposure means less awareness, and in turn a society less equipped to support good health for all. And if ill health is perceived as inevitability for disabled people anyway, then there's no real reasoning for society to make changes to enable good health in the first place, as well as providing justification for disabled people to participate in unhealthy behaviours such as inactivity and poor diet. But for many disabled people, how much of their health status can actually be attributed to anything to do with their impairment or difference? Blind people are more likely to be overweight, but there's no link between eyesight and metabolism. Wheelchair users are more likely to develop type 2 diabetes, but there's no connection between limb and pancreatic function. And there's very little physiological difference between autistic and non-autistic people that would impact health. Yet autistic people die 15 to 20 years earlier from preventable causes. And if we think about it, if ill health is something inherent to disabled people, then there'd be no examples of healthier disabled people, of which there are many. Conversely, if we look at more extrinsic factors, the World Health Organization finds health promotion and prevention activities seldom target disabled people, resulting in poor health behaviours and outcomes. Disabled people experience issues with access to healthcare, resulting in underdiagnosis and treatment for many preventable conditions. And we know that disabled people are twice as likely to be employed, more likely to live in poverty, and have less access to accessible housing, all indicators and wider determinants of health. All of this would suggest that for many disabled people, health has very little to do with anything inherent, but conditions imposed by an inconsiderate, inadequate and inaccessible society. Let's not be so passive as to dismiss ill health as something that just happens to disabled people, when if we look at the facts, disabled people aren't given the opportunity for much else. Thanks for listening, I hope this video was of some interest. If so, please do like, share and comment below. I'd love to hear your experience of health as a disabled person, whether you've been able to maintain good health or not, and what you feel the biggest barriers are. And on that, I hope you all keep well, keep safe, keep your distance, and until next time, take care.